Hey everyone, and welcome to the Brainy Buzz channel. In today's video, we're going to learn about 15 effective ways to lower your blood pressure without medication. So make sure to watch the full video. High blood pressure, hypertension, is called the silent killer for good reason. It often has no symptoms, but is a major risk of heart disease and stroke. And these diseases are among the leading causes of death in the United States. Almost half of U.S. adults have high blood pressure. Your blood pressure is measured in millimeters of mercury, which is abbreviated as mH. There are two numbers involved in the measurement. Systolic blood pressure. The top number represents the force of the pressure when your heart pushes blood into the arteries throughout the rest of your body. Diastolic blood pressure. The bottom number represents the pressure in your blood vessels between beats when your heart is filling and relaxing on. Increase activity and exercise more. A meta-analysis of 65 studies suggests that aerobic and resistance exercise can significantly lower blood pressure, especially for men. In a 2013 study, sedentary older adults who participated in aerobic exercise training lowered their blood pressure by an average of 3.9% systolic and 4.5% diastolic. These results are as good as some blood pressure medications. 2. Lose weight if you're overweight. If you're overweight, losing 5 to 10 pounds can reduce your blood pressure. Plus, you'll lower your risk of other potential medical problems. A review of several studies reports that weight loss diets reduce blood pressure by an average of 3.2 millimeters Hg diastolic and 4.5 millimeters Hg systolic. 3. Cut back on sugar and refined carbohydrates. Many studies show that restricting sugar and refined carbohydrates can help you lose weight and lower your blood pressure. Sugar, especially fructose, may increase your blood pressure more than salt, according to one 2014 review. In trials lasting at least 8 weeks, sugar increased blood pressure by 5.6 millimeters Hg diastolic and 6.9 millimeters Hg systolic. 4. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. Potassium is a double winner. It lessens the effects of salt in your system and eases tension in your blood vessels. However, diets rich in potassium may be harmful to people with kidney disease, so talk with your doctor before increasing your potassium intake. 5. Eat less processed food. Foods labeled low-fat are usually high in salt and sugar to compensate for the loss of fat. Fat is what gives food taste and makes you feel full. Cutting down on, or even better, cutting out, processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood pressure. 6. Stop smoking. It can be difficult to do, but it's worth it. Stopping smoking is good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation, and narrowing your arteries. The hardened arteries cause higher blood pressure. The chemicals in tobacco can affect your blood vessels even if you're around secondhand smoke. 7. Reduce excess stress. We live in stressful times. Workplace and family demands, national and international politics. They all contribute to stress. Finding ways to reduce your own stress is important for your health and your blood pressure. There are lots of ways to successfully relieve stress, so find what works for you. Practice deep breathing, take a walk, read a book, or watch a comedy. Listening to music daily has also been shown to reduce systolic blood pressure. A 20-year study showed that regular sauna use reduced death from heart-related events. And one small 2015 study has shown that acupuncture can lower both systolic and diastolic blood pressure. If you're still watching, then please share the video, and don't forget to subscribe to our channel. Let's continue with the next way. 8. Try meditation or yoga. Mindfulness and meditation, including transcendental meditation, have long been used and studied as methods to reduce stress. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. A 2013 review on yoga and blood pressure found an average blood pressure decrease of 3.62 millimeters Hg diastolic and 4.17 millimeters Hg systolic when compared with those who didn't exercise. Studies of yoga practices that included breath control, postures, and meditation were nearly twice as effective as yoga practices that didn't include all three of these elements. 9. Eat some dark chocolate. Yes, chocolate lovers. Dark chocolate has been shown to lower blood pressure. But the dark chocolate should be 60 to 70% cacao. A review of studies on dark chocolate has found that eating 1 to 2 squares of dark chocolate per day may help lower the risk of heart disease by lowering blood pressure and inflammation. The benefits are thought to come from the flavonoids present in chocolate with more cocoa solids. The flavonoids help dilate or widen your blood vessels. 10. Try these medicinal herbs. Herbal medicines have long been used in many cultures to treat a variety of ailments. Some herbs have even been shown to possibly lower blood pressure. However, more research is needed to identify the doses and components in the herbs that are most useful. Always check with your doctor or pharmacist before taking herbal supplements. They may interfere with your prescription medications. 11. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. 12. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. A meta-analysis found that for people with high blood pressure, garlic supplements reduce their systolic blood pressure by up to about 5 millimeters Hg and reduce their diastolic blood pressure as much as 2.5 millimeters Hg. According to a 2009 clinical study, a time-release garlic extract preparation may have a greater effect on blood pressure than regular garlic powder tablets. 13. Eat healthy high-protein foods. A long-term study concluded in 2014 found that people who ate more protein had a lower risk of high blood pressure. For those who ate an average of 100 grams of protein per day, there was a 40% lower risk of having high blood pressure than those on a low-protein diet. Those who also added regular fiber into their diet saw up to a 60% reduction in risk. However, a high-protein diet may not be for everyone. Those with kidney disease may need to use caution. It's best to talk with your doctor. 14. Drink less alcohol. Alcohol can raise your blood pressure, even if you're healthy. It's important to drink in moderation. According to a 2006 study, alcohol can raise your blood pressure by 1 millimeter Hg for each 10 grams of alcohol consumed. A standard drink contains 14 grams of alcohol. 15. Consider cutting back on caffeine. Caffeine raises your blood pressure, but the effect is temporary. In a 2017 study, the systolic blood pressure of 18 participants was elevated for 2 hours after they drank 32 ounces of either a caffeinated drink or an energy drink. Blood pressure then dropped more quickly for the participants who drank a caffeinated drink. Thank you for watching the Brainy Buzz. If you enjoyed this video, make sure to like and subscribe, and don't forget to click notification bell for more.